Thank you.
You're on.
Thank you. I'm Leyla, Azis. Well, Andrew asked me to talk about the pre-travel consultation. So I put this together last night, thinking of you. So the focus is not going to be diagnosis of febrile return traveler. So it's just a consultation, essentially what we do when for patients prior to the travel. And you'll see this is very easy to do. There are lots of resources available. We are always available for advice for more complicated situations such as immunocompromised people or pregnancy or others. It is reimbursable, so the code is there. There are additional codes for vaccines, and nurses will know about those for each vaccine and then any additional doses. And it's fun. And so I'll go over certain things which will be pretty basic. I believe that will be the essence of what we do, and it'll be quite a lot, actually, than just malaria prophylaxis and shots. So I actually wanted to show here, this is going to be, more or less order, some travel risks, conditions encountered during travel, vaccination prophylaxis. My plan was to discuss some cases, but I have them up here. Not to make it to the presentation. Yes, please feel free to interrupt at any time or ask questions. So that's going to be in terms of travel risk for every 100,000 travelers to developing countries, approximately 50,000 will have a health problem. Out of them, 8,000 will have to go see a physician. 5,000 will stay in bed. 1,000 will be completely incapacitated. 300 will be hospitalized. 350 will be evacuated, and one will die. So, majority of causes are non-infectious, are things that will happen during travel, but will happen anywhere. So there are heart attacks and accidents and so on. So the infectious disease problems actually represent only a small fraction of those issues that happen during travel. The most common one out of the infectious etiologies is the diarrheal illness. There are others, many. Here are the several other risks. So, as I mentioned, accidental injury, environmental hazards, stings and bites, and altitude illness, or other non-infectious problems. Well, we always advise people and give them in the package instructions of what to pack, and none of those, particularly in my arena, infectious disease, I always tell people not to forget their sunscreens, their sunglasses, hats, and so on, first aid kits. And this is how we approach a traveler when they come. So essentially we try to understand what the risk is based on patients' age, comorbidities, prior medical issues related to travel, vaccinations, allergies, and so forth. We try to determine that based on their background, based on their itinerary, with the specific details of each area they'll be visiting. Based on what they'll be doing there, certainly the risks will be different. And we talk a lot of general preventive principles and a few specific issues for each area or traveler. So we want to know age-related issues, underlying illness, immunosuppression, pregnancy, medical history, medication use, vaccination history, immunization records, allergies, trying to understand what vaccines or medications we won't be able to use for the preventable conditions. We don't examine the patients. But review issues like other medical history that will be important will be whether people, for example, have seizures or conduction disorders or neuropsychiatric disease, or being immunosuppressed or being on steroids or other conditions that will be problematic in the setting of certain medications we use or vaccines. So these are like typical questions. Where are you going? We really want the full itinerary. So for people who don't have the details, we often ask them to call back once they'll have all the details, because the risk, you'll see, is different for each area, town, city, not only country. There are like people who are not risk takers, so they'll have all the details of the trip until the last minute, all the arrangements by minute, and people who wouldn't have any idea about what area in the country they'll be visiting or where they'll be staying, wouldn't have like arrangements about staying and so forth. So that's different. We really want all details, including stopovers, day durations, very important with the stopovers, because there'll be certain like requirements, entry requirements, and certain vaccinations for stopover. For example, in a yellow fever area that's greater than 12 hours, they'll require vaccination, even if you didn't leave the airport area. So it's dependent on the country. We want to know what the traveler will be doing, whether it's for pleasure, it's tourism, it's adventure safaris, or mission work. It is important to determine the date of departure, because that will impact decisions about certain vaccinations. For many, you'll have to have sufficient time to develop immunity to seroconvert. So the last-minute travelers we may change our decisions based on the timing. The duration is important, because the risk is not the same for a 3-day traveler versus a month, 3 months, or 6 months traveler. That will also impact the type of medications we decide to use. And certainly whether the traveler will be in the city or the country, the type of accommodation, hotel, home, camping, and whether the style of travel is rural versus urban, budget versus luxury. So during that conversation, you also try to get an idea on how aware the patient is of the details of the trip and the risks associated with the travel itself. So general advice that we give, we reiterate common sense advice. So don't have protective sex, don't drink much alcohol, have fun but not too much fun, wear your seat belts, don't drive, avoid buses, crowded spaces, avoid bats, rodents, street dogs, and other animals. Don't pet, don't provoke, seek medical care if you're sick, use the travel insurance if you paid for it, and many others. And at that point of time, everybody's checking the time, and it's like yes, but what shots do I need? So everybody wants to get to the shot. So to figure this out, you will need to know the distribution of the disease in the areas that the travel will be going to. So for that, I'm going to show you in the end. Hopefully, we'll still have some time. Some cases I just printed here, so I'll show you some maps of example and how you determine that. Then you have to determine the likelihood of contracting those diseases in the area based on the season, dry season versus rainy season, the peak of certain diseases during the time the patient is traveling and so forth. And then you want to know what can actually be prevented, because certainly there are things that cannot be prevented. So what vaccines, in terms of what vaccines are important, so there are only 2 vaccines that are mandated. So maybe none if you're really careful. So I'm going to go over a certain vaccine, tell you that although many think that typhoid is required almost everywhere you travel, it may not, and certain conditions certainly associated with poor sanitation, for example, we do recommend consideration of those vaccines. But in terms of the vaccines that are really needed, you're talking about the yellow fever vaccines. There are specific requirements for certain countries before entering and when coming from a yellow fever endemic area, even if you're in transit, and that is how it looks. And for people who have certain contraindications, there is an area where you would stamp and do a waiver detailing the medical condition that's contraindicated the vaccines, and it often you get a letter as well. The meningococcal vaccination before going to the Muslim pilgrimage, the Hajj, that is another requirement to Saudi Arabia. So these are like the yellow fever areas, so essentially the Africa, South America, but there are like much more detailed maps of yellow fever distribution in each of these countries because the risk is not the same. And I'll show some examples. So the yellow fever vaccination, there have been 10 cases of yellow fever vaccination in unvaccinated travelers from US and Europe over the past 45 years. So it's exceedingly rare. Of those 10 patients, 8 died. 1 patient survived, who was in Spain. Actually, I know somebody who had died of yellow fever, a traveler from Europe, many years ago, maybe 10 years ago. So it's extremely rare. The risk is higher if you travel to West Africa as opposed to South America because of the way that transmission of yellow fever happens in the area. So I gave an example for here, it shows a map, but it's not big enough, of Peru yellow fever area. So the areas that you see in yellow are areas where certainly the transmission is significant. And people traveling to these areas do require yellow fever vaccination unless contraindicated. So there are other areas like here, so Lima, Cusco, typical touristic areas, no vaccine is needed. And there are also some other areas where, like in the northern part of the country, that it may be considered, but insect precautions may be sufficient or would be offered only really risk-averse travelers. So it's a decision. But even in the same country, the risk may not be the same. So the yellow fever vaccine available in the U.S. is actually not available for the past couple of years because the manufacturer is changing production and is not available in U.S. or Canada, but there is a vaccine that is available. I mean, the Stamaril is available for administration for people traveling to high-risk areas in designated centers in the country that had received the FDA approval of use of the non-U.S. vaccine. So there are like 250 centers in the country. For the state of Maine, there are 2. One is at Maine Medical Center. We are not a designated center for administration of a yellow fever vaccine. There is another one in Bangor area. So, the problem is that causes significant delays, and sometimes it takes up to 4 or 6 weeks for people to be scheduled med, and not to the travel clinic, but for example, only for the yellow fever vaccine. Now, I mean, it is a nationwide problem. So, but vaccines have been available for people who travel to various destinations, do not have access, could still get. There are ways of getting this type of vaccine, like in airports and so forth, but certainly it requires that this is administered at least 10 days prior to the exposure to the high-risk area. So, the yellow fever vaccine is an attenuated live virus, and it used to be good for 10 years, but not anymore. In 2013, WHO had changed recommendations and suggested that once you had received it, there was a vaccine that should be good for life, so no boosters will be needed. Now, the yellow fever the yellow fever vaccine in pregnancy is tricky. It definitely has to be given. I mean, the risk is significant. The exposure cannot be avoided. Like the pregnant woman has to travel. It can be given. I personally have never given to a pregnant woman because in general we avoid like live vaccines. In HIV, it's another condition in which you have to be cautious because it's a live vaccine, so you try to avoid it in people with immunosuppression. But if you have to give it, it could be given if the CD4 count is greater than 200. And the recommendation is that you don't do 2 live vaccines at the same time. So apart from MMR, it's very effective, 100% effective with a single dose. It takes about 10 days to develop immunity. There's a recent study published earlier this year that essentially showed that the immunity declines, and maybe 10 years and maybe lifelong is not lifelong, so maybe after 10 years, you have to consider booster if you go to a high-risk area. It's a recommendation from ACP, actually, like the WHO still recommends only lifetime vaccine. Next, like a vaccine that's really a must for certain areas, like meningitis belt, like sub-Saharan Africa, so the countries that you see in that deep purple blue are areas where people have to receive meningococcal vaccine, especially if, for example, you're going to do humanitarian work and come in contact with the local population, so higher risk. It's an area that's hyperendemic, and the areas like in the light purple are to be considered, especially if certain risks are present. So for travel, it's the quadrivalent meningococcal vaccine, either monoclonal and and you need a booster if you're traveling again in a high-risk area every 3 to 5 years. So the Hajj, certainly a very crowded area, and that is, so 2 million Muslims from 140 countries go to Saudi Arabia every year. So the requirements are the flu, the pneumococcal for the people over 65, meningococcal vaccine. You have to have a stamp of meningococcal vaccine given with at least 10 days prior, but not more than 3 years since the prior dose. And also hepatitis A, B, and typhoid. Hepatitis A is certainly associated with poor sanitation. It's made out of the inactivated virus. Ideally, you would give with at least 2 days prior to travel, so immunity levels 10 to 14 days prior. And there is also the combined form of hepatitis A and B. The typical schedule includes 2 doses 6 months apart. That's 100% effective, and the immunity lasts lifelong, so certainly no boosters will be needed. But a single dose has a very high level of protection. So majority of people whom we see prior to their trip only get 1 dose, certainly before the trip, and that's the immunity, the efficacy rate reaches 86% with a single dose. We always encourage them to get a second dose after return 6 months later. So. Like some people recommend hepatitis A vaccination, regardless of where you go, but at risk remain the long-stay travelers, people who live or visit rural areas, people who would visit friends and relatives, people who live outside the prearranged fixed itineraries like hotels, restaurants, and so forth. They wouldn't be there. So anything that is considered to be high-risk behavior, we do recommend hepatitis A for some areas. Typhoid fever. Typhoid fever is highest. The risk is highest in travelers to South Asia. It's on the top of the list, but also Southeast Asia and Sub-Saharan Africa. So particularly for people going for a longer time, although short-stay travelers are also at risk. Travelers with adventurous eating habits, persons who will travel outside prearranged fixed itineraries, especially in rural areas, people who would visit relatives or friends. Why? Because they'll be more likely to eat unsafe food and water. People who already had typhoid disease should not consider themselves as immune, as you could have infections with different serovars like enterica, typhi and paratyphi ABC, so you could get multiple times, plus immunity declines over time. So you could get like the same disease with the same serovar after you got one episode. And the vaccines will only, either form, the injectable or the oral, will only protect against the salmonella enterica, but not the typhi. So 2 forms of vaccines. The oral vaccine that I have on the right side here, it's the typical vaccine we recommend prior to travelers, consisting of 4 doses that are given every other day over a course of a week. So day 1, 3, 5, 7. So you complete immunization over 1 week, and then the immunity starts developing 7 to 10 days after that week. So you have to be very good about taking the medications, because the vaccine is not 100% effective. In fact, the effectiveness only reaches 60 to 70%. Some people say 80%, the most optimistic ones. So there is no data of what the efficacy will be if you're not taking that, at least those 4 doses. You skip a dose, or you may not be effective. So we advise travelers like not to take it with hot tea or like any sort of like hot beverage because it will activate the vaccine. To avoid antibiotics for the week of the vaccine and for minimum 3 days after. We advise them to refrigerate. That's very important. If you forget it on the counter, to throw that away. And it's a very expensive vaccine. It costs about $100-something, $20, I believe. It's very important to know the price of the vaccines, actually. So it's a live attenuated vaccine. So obviously you avoid in pregnancy or in people who have other conditions that would weaken their immune system. And has the advantage of giving immunity that lasts a lot longer. So 5 years as opposed to 2 years with the injection. The injection we reserve for the last-minute traveler because you don't have the week to complete the vaccine, but still immunity develops 7 to 10 days after the injection. For people who, for whatever reasons, like their schedules cannot adhere to the schedule of taking the medication for the week, or are not able to swallow pills, or people who are immunocompromised, certainly. It's also safe in pregnancy. Okay, sufficient. So these are like uncommon vaccines. So the Japanese encephalitis, rabies vaccine, anthrax, cholera, they are like very unusual vaccines. Even we administer them quite rarely, but we do. So for the Japanese encephalitis, it's an activated live virus. So we only get like if certainly you're traveling to the Japanese encephalitis endemic areas. I'm going to show a map. I think I have one. The risk is extremely low in travelers. So like ranging from 1 to 100,000 to 1 to 1 million travelers per month. It's a very expensive vaccine. For a single dose is around $500. And they have to give multiple doses. 2 doses, like a month apart, and there's also an accelerated course, like they could be given 7 days apart. The risk is low, so what we advise travelers is to avoid mosquito bites, certainly, using insect repellents, and I'm going to show a lot of other advice in terms of insect precautions, because the risk is low. So the mosquitoes that transmit the Japanese encephalitis feed also during the evening hours and daytime, so we recommend insect precautions. So for people who would have the typical traveler will go a very short duration, we definitely do not recommend. But for people who will go for a much longer period of time, who will be outdoors significantly, who will visit, will be in the agricultural areas, has been particularly associated with the rice plantations. For people who cannot avoid mosquito bites and so forth, quite at risk, will be in the area for at least a month, if not 6 or more. We advise, we ask people like to consider it's certainly not covered by insurance, and it's an expensive vaccine. There are other travelers who go to areas where the risk for Japanese encephalitis is extremely low. People like really don't want to take any chance and desire maximum preparation, like every possible vaccine prior to the trip, and we offer that. So there are minimal or no risk side effects. So rabies vaccines, again, like we do not recommend that routinely unless people go to very remote areas where the vaccine, where the immunoglobulins would not be available. So we typically reserve like the rabies vaccination for the people who will be at ongoing risk, at high risk, such as vets, the wildlife rescuers, like people who would be doing direct ongoing risk, will be spending significant times outdoor, hikers, bikers, and so forth. It is not routinely that we recommend. We don't recommend to avoid any like provoking animals, certainly. And we recommend like to take care of any wound immediately, wash it with soap and running tap water, ideally for 15 minutes. And possibly use iodine or like clean the wound and then be evaluated, and if deemed at risk for rabies vaccine, be vaccinated at that time. But up a request, and if we determine that there are certain areas that in which the access will be very difficult and people at risk, we offer the vaccine. So 3 doses of vaccine prior to the trip. But that would not eliminate the need for additional 2 doses if you're bit or if you're a bit or like scratched by bat or so. So you get 3 doses before, 2 doses after, but it eliminates the need for you to receive the immunoglobulin after. So the rabies, this is where we have the Japanese encephalitis area. The risk again is very low for travelers. Routine vaccines, we always recommend the influenza, Tdap, make sure that people are up to date there, MMR, pneumococcal leaf communicated for age. There are other specific concerns, so diarrhea typhus, so we talk about food water, borne infections, the diarrhea, typhoid, hepatitis, the insect-borne, malaria, dengue, chikungunya, and Zika, and others, the respiratory, viral, bacterial TB, STDs, and others depending on the condition. So food and water precautions, remember boil it, cook it, peel it, or forget it. So we always recommend bottled water. We recommend travelers to get them a full list so you have the same talk each time. We recommend them to consume only well-cooked food served like steaming hot at places are known to be catering for foreigners, to avoid street food, to avoid leafy salads, vegetables, fruits that cannot be peeled. So we only recommend bananas, mangoes, avocados. We avoid ice cubes, chips, any sort of tap water, even like to brush the teeth, including for children. We recommend avoidance of undercooked meats, mayos, dressing, salsas, and so forth. To come up with a long list and also give a long printed material. And yes, and certainly, I mean, you travel and so people always ask what to eat, and this is what we say. These are considered to be safer foods. So stick to the tortillas, nuts, So that will be like the way to go. Or like certainly places that. No, but that does not exclude even the luxury places that you would go. The food could be handled by the local person, right, who may be a carrier of the typhoid and so forth. So there is like no guarantee. So water precautions. We recommend drink only sealed bottled water or chemically treated filtered or boiled water. Use the same for brushing teeth. It is safe to drink canned, boxed, commercially bottled carbonated water. Drinks stick to international brands like Coca-Cola. Boil water for 1 minute. 1 minute is safe. You could do chemical disinfection. So you put 5 drops of % iodine in 1 liter of water, and you mix and let it sit for 30 minutes. So I'm giving like cooking recipes here, and then it has a terrible taste, like the iodine. And certainly you cannot give iodine if somebody's allergic to iodine or is pregnant or has thyroid disease and so forth. But that's if you don't have anything else, it's safe to do this. And some people recommend to add maybe like a tablet of vitamin C after the iodine had been in the water for at least 30 minutes. It just like takes away the iodine taste and it makes it more palatable. But there are things that you could buy from Cabela, like LL Bean or other like the sports goods stores that are like potable aqua and so forth. So you can use that. We recommend it. Like portable filters, like not recommended. Yes. What's that? Like straw and those things, you don't like any of those? No, I mean the only things that we recommend, we only recommend either things that kill bacteria, viruses, like 99%, like those things like potable aqua, and then like filters. No, I mean they're not effective. We recommend stick to the bottled water or just boil the water or put some iodine or bleach in it. So this is like water is not supposed to be. India. So travel is diarrhea. I like words. I like words like Montezuma's Revenge, everyone knows about, or like Turista, but Maladie de la Mer Rouge is definitely So collected lots of things. Yeah, so travelers' diarrhea. We talk a lot about diarrhea, like during like this travel visit. So 80% certainly is bacterial, and this is what we try to prevent by all these interventions mainly, and with prophylactic antibiotics. So we'll talk about this. So the bacteria are the major ones. For viral, we do not really assess or parasitic. Certainly you follow the general rules that will protect you for those as well. So ETAC, Salmonella, Shigella, Campylobacter, Staph aureus causing acute vomiting. So treatment of diarrhea, recommend travelers to carry like antidiarrheal agents such as Imodium or Pepto-Bismolol, and they could get over the counter, and certainly there are six, and you're very familiar with those. But we also prescribe antibiotics for self-management for moderate to severe disease. So always tell travelers if they have only mild diarrhea, they should try like to hydrate themselves and use oral hydration salts and so forth, like diet, the bread diet or so. But if the diarrhea is severe, if let's say it lasts for more than 48 hours, if it shows any signs that could be more suggestive of invasive disease, such as like mucus or blood, high fever, they're very unwell, or if they are worried, or they have severe conditions like as their own medical conditions like suppression or AIDS or have disease or so forth, we recommend that they diagnose themselves with diarrhea and use antibiotics. So on the top of our list is azithromycin we prescribe nowadays, like 500 milligrams, 1 tablet a day for 3 days in cases of moderate severe diarrhea. So always tell people not to prevent diarrhea, only if needed. So it's very effective against everything I mentioned, like E. coli, Salmonella, Shigella, Campylobacter, typhoid, cholera. So essentially, a majority of like the bacterial diseases that could give people the diarrhea. So ciprofloxacin is an alternative. It's less desirable if you're traveling to Asia. Very high risk of resistance to ciprofloxacin, but it's an alternative. 500 milligrams for 3 days. Rifaximin may be an option. Maybe an option that we typically don't prescribe. It has a much more narrow spectrum, but it may be a good option if you're going to Asia because they tend to have more of the Campylobacter causing diarrhea, and that's a good option for the Campylobacter. It has a narrower spectrum. So insect-borne is insect-borne. Malaria is by far more common. Dengue, chikungunya, Zika virus, other things that you cannot really, they are transmitted by people that feed during the day. You cannot really offer anything except for insect precautions, yellow fever, Japanese encephalitis. So we recommend to use repellents that have DEET of at least 25 to 30%. There are brands that sell 90% or more. The studies have not demonstrated a significant benefit over this one. So this is like the number we're aiming for. We recommend like travelers to wear long sleeves, use and so forth, coils, meds, sprays, and things, air conditioning, other interventions. Lots of brands also always recommend to read the label. The majority of them will have activity of 2 to 4 hours. There are other long-acting insect repellents we could apply every 12 hours. And certainly bed meds and any other. So malaria distribution, so much more detailed maps are available when you look at certain areas because it is different, the risk is different even in the same country. Prophylaxis, chemoprophylaxis, you recommend like for malaria, not just in case, so people have to take malaria medications before the trip, and the time to start it is different for each medication, and we make a decision based on what else is going on, patient's preference, risk of allergies, interactions, experience with other medications, and so forth. And so on the top of our list, it's not here. So again, as I showed, like there is a different risk for different areas. So chloroquine is weekly, so you have to start 1 week or 2 weeks prior to the trip, and then you continue every week for the time you're in the high-risk area, and then you continue for 4 weeks after you left the area. But there are like very few areas where malaria is chloroquine sensitive, so we almost never prescribe it. And there is no. I try like to prescribe it like for a traveler to travel to Haiti last year, and I said, because they just don't prescribe it at all, and it actually wasn't available in any pharmacy in Portland. So mefloquine. Mefloquine is also weekly. Also, you start 2 weeks. Some people advise like starting 4 weeks. Why? Because it has significant, psychiatric side effects, and it's contraindicated in people who had depression, had been suicidal, had schizophrenia, had depression. So you have a chance to observe those side effects before the patient is actually traveling. We very rarely, if ever use it. It is okay for breastfeeding. Doxycycline is a reasonable alternative. We give it like 1 day prior to the trip, especially for people going like for short term. And then you do it like for the entire duration of the trip daily, and then you have to continue. That's the big disadvantage. For 4 weeks, you go for a week, and you end up taking more medication for more than 5 weeks. So it is like this is a disadvantage, and certainly it's an antibiotic and carries all the side effects associated with the doxycycline. So the medication we prescribe most commonly nowadays is the Malaron. So very well tolerated and very effective. So it has the advantage of being able to start it just before the trip, 1 to 2 days prior. Then you continue daily for the time you're in the high-risk area, and then you continue for 7 days after you came back. So it gives you the shortest duration. It's a good fit for the short-term travelers. So in summary, basic counseling can be provided by the majority of family physicians. I think this is very easy. That's all we do. Consultation for more complicated cases available from us. We talk just general prevention, common sense, being up to date with the vaccines that they would typically require. Yellow fever, certainly, is very important. It's like if required, yellow fever vaccine. Malaria prophylaxis just second, but it's important certainly what you do. Typhoid hepatitis A, always optional. Maybe you don't need it if you're careful. So we always encourage people, like based on the risk, particularly going to consider, but it's not us. And pregnant women, special population are more difficult. I shouldn't even get in there. There are like multiple resources available. So the CDC website, that's the most important one, like the yellow book, like the printout or the electronic format. The one that you see at the bottom of the list is the one we use most commonly, Travex. And
do we all have access to that, or?
See, I know about that. I mean, I personally still use the access I had when I was a fellow at BMC. So I don't use this one that much, but I think it should be easily available to all of you. And I'll show just how it looks for a second. I don't know if probably we don't have a line like for some cases, but I have like at least one if we have a couple of minutes, because I had printed them here if you want, like a minute or so, and I'll pull the information here, like to see. Okay, so I'll have a case. Maybe it's not this. I think I pulled this map, but maybe I shouldn't do this. All right, I have this. So this is how the site looks, So it may be better that I'll show you. So you have a traveler report, a provider report, are pretty much the same, and the maps report. And then you start like a report builder. You go here, new, and then you could select here the kind of information you need, including safety data and so forth. So the next step would be add a country here. So I'm going to write Kenya. And
difference is what you get from the CDC smaller.
Yeah, I mean, this is more interactive. So then you go like the next step, select the maps if you want. I always want to look at the maps. And then you get like the traveler's report, and it gives you exactly the health concerns, so the yellow fever. And they tell you, is this a requirement is a requirement, is there a risk? And you say, it's not an official requirement you see here in the table, but yes, there is a risk for transmission, and therefore vaccination is recommended. And so forth, they go over each risk, and it's very helpful. I'll give you the last minute updates on outbreaks, for example, or consular advice, or and so forth. So very important. And then the last, I'll take only one more minute. Here, I want to show you how the maps look like. scrolling down, it's a lot of very useful information. And the maps, here, for example, it gives you like the malaria map for Kenya. I mean, you see like the entire country is in red, so they require like people like to be on medication. For other countries, you'll see different indication, and they go by regions, districts, and this is updated daily, and this is based on the CDC data, and this is WHO data. So it's like very reliable information. Yellow fever, you see like the yellow fever map. So you see the areas where people here, like people required to receive vaccines, so you know exactly what the itinerary is when the people will be traveling, and then you see like here part of the country where people do not necessarily require to receive yellow fever vaccine. So insect precaution will be sufficient because the risk is not the same based on transmission in the area. So you make a decision, and so here then they go to the meningitis belt, and you can like exactly, and so forth. A lot of very useful information, very easy to get access to. So I think it's very easy if you don't have access. I think could get access, So it shouldn't be a problem at all. I think you should have access. I think we should, I mean, you also have access. And I mean, if you're interested in like global health problems, it's a nice way like to keep up with what's going on elsewhere. So.
Does it have a patient print like information section you can print off?
Oh yes, absolutely. And it's like we never do that. I mean, we print a lot of information for patients here, but there's a way to personalize this. So you could actually type there like specific recommendations for the patient. Don't forget your antihypertensive medicines. Don't forget your insulin needles or whatever you want to do. Don't forget whatever your conversation with the patient was like. Could be very personal.
So you just print out all that you see, or is there another part that the patient's print?
There are like many ways of printing. There are many ways. You could actually print sections. You don't have to print the full report. You may be interested only in the diarrheal illness, and you go and select only that part and choose what you want to do. Yes.
Is that thing on Ebola?
I mean, I do not have like a quick update on Ebola, but do you have like specific concerns about specific areas?
Or just going to be available and
vaccines and so. I know that there is work in that. I don't have like a last minute updates of what how far they were, but. It's a good thing it's important like to go back and always like look and see any updates. I didn't look in a while what's going on when they research. It's certainly anything could be a global thing at some point. Any infectious disease. Yes, thank you. Yes, thank you, Andrea. Thank you. Oh no, thank you. So please feel free anytime to call with any questions. I've had a bunch of cases, but next time.